Who do you see as a good candidate for medication tapering?
Almost everybody, if we're honest. Um, I think if folks are ready to taper off of medication, that's a key factor. And then if their provider, if the person who's been prescribing the medication thinks that it's medically safe for them to do so. I am not a prescriber. I have a general understanding of how these things work. It's probably better than a layperson understanding because I've had more experience and I've done more reading, but it is nowhere near a prescriber level of understanding. That's not my area of expertise. And so I always defer to the prescriber's opinion on whether it's safe to taper. That said, most prescribers I've worked with are actually very excited to get their clients off of sleep medication, because usually sleep medication is a band-aid. It's not fixing the problem, it's just making it a little easier to get through. Which, don't get me wrong, is not the worst thing, but it's probably not great in the long term. Things that I would look out for is if folks are on a lot of medication, I would be more careful and would probably want to have like an in-depth conversation with a prescriber. And with CBTI in general, it's counterindicated if somebody has active substance abuse challenges. If somebody is in recovery but is on a lot of sleep-related meds, that's a place where I would pay extra attention and would maybe not want to do a taper without like very intensive consultation, because I would want to make sure that everything was being managed.